Cough is another physical symptom associated with the respiratory system, very common among the patients who are under palliative care. Cough is the physiological reflex that is employed to clear the respiratory tract when there are certain irritant substances present in the respiratory passage or the respiratory pathway. And cough also occurs when there are any foreign substances or the particulate material in the respiratory tract. So to clear the respiratory tract from other substances, foreign substances, cough occurs in the individual. This is a common physiological reflex mechanism that occurs in any individual. The cause of cough could be when there is airway irritation. When there is irritation in the pathway of the air, cough can occur. So this usually occurs due to environmental factors also. When there is smoke in the atmosphere, smoke, all of us know, there are various chemical components associated with smoke, and also particulate matter is present in the smoke. So when a person inhales the smoke along with the inspired air, it can cause cough, or the fumes that comes from chemicals or from other substances can also make a person cough. And when the atmosphere is very dry around, cough also occurs in the individual. Tumour, when there is a endobronchial tumor. Endo means inside. When there is a tumor inside the bronchi, that can trigger the occurrence of cough in the patient undertaking palliative care. Or it can occur due to extrinsic bronchial compression. Extrinsic is outside, bronchial compression. So the bronchi is being compressed due to certain external factors. Those external factors could be due to certain diseases. It can be due to tumors or cancers that compress the bronchi, and this will disrupt the passage of air, and it can lead to cough in the individual. Aspiration. Aspiration is when particles enter the respiratory system. Like it can also occur, cough can also occur when there is vocal cord paralysis of the voice box, the muscles that are associated with the voice box. And reduced gag reflex. The gag reflex is something which will not allow us to swallow, right? So that can also cause cough in the individuals. Airway irritation. So the airway irritation can occur due to a tracheoesophageal fistula. So the tracheoesophageal fistula, I have already told you that it is an abnormal connection between the two organs, here namely the tracheo and esophagus, because they are closely present. Gastroesophageal reflux can also be another reason for the occurrence of cough. So gastroesophageal reflux is when the contents of the stomach enters the esophagus. So it may move upwards up to the pharynx, which is common to both the respiratory tract and the foot pipe, foot pipe and the windpipe, and this can lead to cough in the individual. Infection, when there is a post-nasal drip. Post-nasal drip is when the mucus secretion of the nose, it goes into the throat. That is called as the post-nasal drip. Laryngitis is an inflammation of the larynx. Tracheitis, inflammation of the trachea. Bronchitis is inflammation of the bronchi. All of these infections can cause cough. Increased bronchial reactivity due to the angiotensin converting enzyme inhibitors. This can lead to increased in the various physiological mechanism, including it increases the blood pressure of the individual. Here it is associated with the occurrence of cough and also asthma. When a patient has asthma, definitely there is cough in the individual. Cough is aggravated in the individual. Sputum retention. When there is more of phlegm or sputum inside the airway or inside the lungs, this will lead to cough, or it will increase the cough in the individual, so that the phlegm or the whatever material that is present in the respiratory system has to come out. So the cough is a mechanism employed to remove the sputum inside the respiratory tract, or when there is excess sputum, which is called as the bronchoria. Lung pathology, when there is infection in the lungs or infiltration in the lungs. Infiltration in the lungs could be the primary or the secondary cancer. Primary cancer is when the cancer occurs in the respiratory system itself. Secondary cancer is when it had occurred in some other part and it had moved to the lungs. It is called as the secondary cancer. And lymphangitis is the inflammation of the lymph vessels. Carcinoma, cancer. And pneumonitis is inflammation of the lungs, which occurs due to radiation or chemotherapy. Radiation as well as chemotherapy, both of them are given for as a treatment measure for the patients who have cancer. So the radiation can affect the lungs, or the chemotherapy, the chemicals that are given for the treatment of cancer can affect the lungs, and it can lead to cough. Chronic obstructive pulmonary disease, they are a group of disease which affect the lung. Pulmonary edema. Edema is something where there is accumulation of fluid, like in the congestive heart failure. There is accumulation of the fluids, or due to pericardial effusion. Pericardial effusion, when there is more amount of fluid between the heart and the pericardial membrane, we call it as the pericardial effusion. When there is pericardial effusion, there is enlargement of the heart, or distension of the heart. This can compress the lungs, and this can lead to cough in the individual. Irritation of other structures associated with the cough reflex. So cough generally occurs when there is some irritation in the pleura, in the pericardium, and in the diaphragm. So when something irritates these structures, namely the pleura is the membrane surrounding the lungs, pericardium is the membrane surrounding the heart, and diaphragm is present between the thoracic and the abdominal cavity. So whenever there is irritation to these structures, it results in cough. And all those structures, when they get irritated, it can aggravate cough in the individual. What are the treatment options for cough? Treat the specific cause. So find out why cough occurs in that individual and try to treat that particular specific cause wherever possible and wherever appropriate. And certain general symptomatic measures can also be undertaken, like you can avoid smoke in the nearby area, avoid fumes. Atmospheric humidification is they can be moved into a air conditioned room where the humidity of the air can be maintained, and the humidity is the atmospheric air is not very much dry. Nurse the patient in position of the least discomfort. As we saw in breathlessness, the patient's head can be elevated, or the entire back of the patient can be elevated, or the patient can be made to be seated in a sitting position. So all of this may reduce the discomfort in the patient. Aid expectoration if cough productive. So the expectoration process can be given if the cough is going to be productive for such patients. It may be contraindicated for patients who are weak or debilitated. So you cannot give the expectoration, the medicines that are given for expectoration, to patients who are really very weak and who are sick. So, or debilitating patient, you cannot give it, because the cough itself will make the patient more serious or severe, or he may even die. Steam or nebulized saline are as effective as inhalations containing menthol or eucalyptus. So you can give steam. The steam inhalation of the steam can give better relief to the patient, or nebulized saline can be given to the patient, which can relieve the cough or they can be made to inhale the steam containing menthol or eucalyptus. The chemical mucolytic agent like acetylcysteine can also be given. So mucolytic agent will are those that will break down the mucus. Sometimes the mucus will be very thick and solid. So they can be used to degrade the mucus. So there here we use acetylcholine for that purpose. Atmospheric humidification can be done. So if the external environment is very dry, they can be moved to a place where there is the humidity of the air is maintained, like in an air conditioned room. Physiotherapy may be helpful for some patients. Bronchodilators can be given. Bronchodilators are those which will relax the bronchi, and it can relieve the patient of the bronchospasm. And only when there is a bronchospasm, there is more of cough in the individual, like we see in the asthmatic patients. Antibiotics can be given if there are any infections. Cough suppressants can be given if there is persistent and dry cough. So the cough suppressants are those that will suppress the cough in the individual. Opioids or the opioid analogs. Analogs are those that act or behave like the opioids. Nebulized local anesthetics can be given. Local anesthetics when there is some problem in the diaphragm or the pleural or pericardium, etc. There you can give some nebulized local anesthetics. Corticosteroids can be given for lymphangitis and carcinomatosis. Sedation may be useful. Sedation is the drugs that can make the patient feel sleepy. So they will sleep when they take the sedatives. So this may be useful to the patients, particularly at night, because when they sleep and when there is cough, they'll be not able to sleep. There'll be disturbance in the sleep, and therefore at night sedation can be given to such patients. Terminal respiratory congestion is the next problem that occurs as a result of problems in the respiratory system. Death rattle, the terminal respiratory congestion. So the name itself says it is terminal, end stage, respiratory congestion. So there is congestion in the respiratory tract. Is the rattling, noisy or gurgling respiration. So the respiration is very noisy. Usually when we respire, the respiration is not known to us or to the person who sits nearby. But this terminal respiratory congestion, which is called as the death rattle. What is that rattle? Rattle is that which is used to make noise. Okay. So here it is rattling. The breathing itself is rattling. It is noisy. The person who is around is able to hear the person's respiration. It is a kind of gurgling or noisy respiration of patients who are dying. So they are almost at the end stage. Why does this death rattle occur? It occurs due to accumulation of pharyngeal and pulmonary secretions in the patients who are unconscious or semi-conscious and too weak to expectorate. So why does this noisy respiration occur in the patient? The noisy respiration occur in the patient because there is more secretions in the respiratory system, like the secretions of the pharynx and the secretions that are present in the respiratory tract. The patients may be unconscious because I told you already they are in the end stage. The patients may be unconscious, or they may be semi-conscious, or the patient, they may be very weak to expectorate. Expectoration is to spit out the secretions that are produced in the respiratory tract. Treatment. Therapy is often more for the comfort of the relatives and other patients, as most of the patients are no longer aware of their surroundings. So in such circumstance, the patient does not know what is happening to him or her, and the treatment that is given for the congestion that occurs in the respiratory tract is only for the comfort of the family members or the relatives or the patients who are nearby. Position the patient on their side. So instead of making them to lie flat, they should be positioned on their left side or on the right side. Oropharyngeal suction should be reserved for unconscious patients. So the oropharyngeal suction is a small thin tube is inserted into the respiratory tract, and on the other end vacuum is applied. By this process, the secretions, the mucus, sputum, phlegm that are present in the passage of the respiratory tract can be removed by applying vacuum. So that is called as the oropharyngeal suction. So this can be reserved for the unconscious patient. If the patient is unconscious, they cannot spit out the sputum. In such patients, oropharyngeal suction would be helpful. Anticholinergic drugs can be given because they will suppress the production of the secretions in the respiratory tract, and then reassure the relatives that the noisy breathing is not causing any added suffering for the patient, because when we hear the sound, the noisy breathing in the patient, we get scared. Particularly the family members and the relatives, they get scared. So you have to explain the relatives and the family members and say that because there is noisy breathing, there is no pain, additional pain to the patient, or they are not suffering actually. It is only because of the secretions that are present in the respiratory tract. So the relatives has to be reassured.